Hi there, it's Gabrielle Nicolay from SpeechKids, where we teach little kids to talk and help parents understand their little kids. And today we are going to talk to Dr. Christina Royster of Play on Words Therapy. Hi, Christina.
Hi, how are you?
I'm fine. I'm so glad that we got to have this conversation today on augmentative and alternative communication. But before we get into all of that, tell the good people what you do, where you practice, all the things.
Sure. So as you said, I have a private practice, Play on Words Therapy, that is mostly part-time, although many times it feels like it's full-time as well, but it is part-time. And then I also work for Montgomery County Public Schools. And so I am on the AAC team there, and I do that full-time. So yeah, full-time Montgomery County Public Schools, and then part-time Play on Words Therapy. And so the majority of my clients with my private practice are early communicators. A lot of them are on the autism spectrum. I have some other clients that have genetic syndromes, Down syndrome, and also just some that are delayed, late talkers and early communicators.
And so when you, how did you get involved in AAC? And I should clarify, augmentative and alternative communication, right? AAC or AugCom. So just to work out the acronyms. But how did you get interested in that?
So it actually is, like many speech pathologists come into the field through personal experience. So my brother, he passed away about 11 years ago, but he had cerebral palsy and profound intellectual disability. So, I grew up around PTs, OTs, speech therapists my entire life. I thought it was completely normal to have a switch drawer and, for like your house to like, oh, okay, we're going to play a game, pull out a switch. So I just grew up around AAC without even really knowing what it was or knowing kind of that it was, a whole specialty field. I don't even know if I realized it was, part of speech therapy for the longest time. But yeah, so I grew up around all types of therapies, especially speech therapy and AAC. And then, so when I decided that I wanted to be a speech therapist, which was around my junior year of high school, that's when I started getting a lot of experiences with mostly kids on the spectrum and other, more medically complex or just complex communicators. And all of my experiences, besides, some of my adult placements, I've always tried to be with the more, more complex cases. And I've always been more interested in it. And so my clinical fellowship year, and for the first 5 years of my career, when I was just a school-based SLP, and so I just worked in elementary schools, and most of my caseload were special populations, so they were in self-contained classrooms, and that's where I kind of really got thrown into it and had to learn and figure out what was the best way to serve each kid, because they were all so different, but almost all of them had a need for AAC because they were all pretty impacted. A lot of them were in like community-based classes and working on those functional life skills. So I saw a wide range of low tech and mid tech, a little bit of high tech with the iPads, but more so the low tech and mid tech devices. And so that kind of just got really into it through that. And then when the opportunity arose for the AAC team, I was like, I think I would like that. So jumped into it. And like I said, my private practice, a lot of the clients just end up a lot of times needing AAC, whether it be something like picture symbols or it be a device. So,
and what's the process that you use? I'm going to ask, actually, first I want to ask you, is there any evidence to suggest that using pictures, using an AugCom device will delay speech? This is something that I get asked all the time. And so I'm going to ask you so that we can have it out right here.
No, there's actually more research that suggests that using a type of AAC, whether it be pictures, whether it be a device, that actually supports, development of verbal speech. So a lot of kids, you'll hear them, maybe, you kind of feel like, okay, but I was modeling language this whole time. I was trying to get them to imitate me. But something about, using a device or even, like I said, picture symbols, a lot of times you're hearing a lot more of that, either that imitation when they're handing you the picture symbol and you're labeling a cookie. And a lot of times they're making those approximations or they're saying the word more than they were before you introduced it. And I think it's also giving that visual support definitely, lends itself to developing that language, receptive and expressive. So yeah, there's been a lot of research out there, and it all points to that this is helping verbal speech and is not any form of giving up on verbal speech. We're still working on a lot of those, oral motor skills, as well as, like I said, like imitation and developing those language skills, but all of it points to that it's helping it. So
what's super interesting to me actually about that imitation piece, right? Because imitation is like foundational to everything that we do, pretty much, right? That we do as speech therapists, but also that children learn. If we don't have imitation, we're going to have a really hard time.
Yeah.
And that the fact that the device, this is more for high-tech stuff, that model, that word is pronounced exactly the same way, every single time.
In the same exact tone, how our tone can change, but we're asking a question versus responding, but it's always the same, like you said.
It's super interesting to me. And for kids, particularly on the autism spectrum, but probably anybody, they rely so much on a pattern, right? I think, and it's always interesting to me that like, oh, of course, that makes total sense that they would begin imitating if they had like a pattern that was only one way.
Exactly.
In terms
and
of pronunciation.
More, generative of their own response rather than something that someone gave to them. Like, yes, imitation, obviously that's really important, but it's also really important to building that initiation because they are in control of forming that sentence, whether it be pushing a button or putting those pictures, symbols in order. So it also, really encourages that initiation skill, which is so important, especially for kids on the spectrum.
So do we just, I'm asking you all questions, like super leading questions here, but can you just like hand a kid a device or some pictures and expect them to begin communicating with it?
No, not usually. I mean, some kids are very impressive with their understanding of, especially, iPads, they can swipe away and they know how to turn it on and off. But the general answer is no, because, just like we learn to speak by listening to other people talking, especially the adults in our world, we have to model that same communication system with a child who is learning to communicate using that system. So, because if there's no one there to kind of show them where the vocabulary is, how we can even, use this device for different types of things, even beyond requesting, then they're not going to, usually figure that out on their own. Or, you're not going to be as likely to use something if it looks so different to you and no one's really showing you how to use it. So it's really important to provide what we call that aided language stimulation or aided language input. So really even just asking a question, modeling on a similar system, if not the same system, or, modeling a response and then kind of giving them that wait time. And we don't always, have to expect that a child is going to immediately respond using their device because they're still getting to know it. They're still figuring it out. And they may just, in general, they probably have a language delay. So it may be tricky. So we're giving them that model, but where you might not necessarily expect them to respond immediately, but hopefully over time and giving them a lot more of those opportunities, then hopefully they'll start, to pick it up. But no, we can't expect them to know it immediately.
This is super. I've been spending a lot of time thinking about this too, which is, kids in typical language development, right? We expect that after one or two instances of hearing the word, the child recognizes what it might refer to, right? And then after 4 or 5 in typical language development, they probably are able to say some version of that, depending on how old they are. In something like autism or any kind of other language delay, that process is not in place. It's not intact.
Yeah.
And so we really are, and this is something I'm sure you remind your parents of this all the time, and I do too, which is it's gonna take them more repetitions. So we have to build in and oftentimes those kids are not doing their own practicing. So, toddler in the crib, ba, 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 ma, 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 da, la, 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 right? They're doing their own therapy. So we don't have to do theirs. These guys are not. And so they're missing a lot of practice opportunities. And so we have to walk them through it. And so to your point about aided language stimulation, which basically means, right, you're pushing the buttons, you, the adult, are pushing the buttons, showing them, right?
Yeah. Or at least just gesturing to it if it's a communication board, whatever system that they're using. But yeah, you're kind of pushing those buttons. And ideally, you'd have the same system. I know everybody's not going to have just 2 iPads sitting around, but if not, maybe you have, a printout of the exact same, language set that they're using and you're pointing on your board. So yeah, trying to show them using that same system.
Oh, that's interesting. I hadn't thought of that. So having like a replica, because you don't want to be grabbing their board all the time.
Right, because that's their voice.
That's their
And,
voice.
you know, there's been a lot of research just talking to AAC users, especially, you know, adult users or teenagers who are able to, you know, kind of express how they felt about the process of learning AAC, and just lots of different, there have been a lot of interviews and stuff, and a lot of them have said that they actually sometimes felt like it was a violation when someone just kind of grabbed their system and started showing them like, yes, I know you're trying to teach and you mean well, but you know, that still at least ask first maybe before taking it. But it's still preferred that, you know, you're using your own system, whether it be like a low tech board or another of the same device.
This is so interesting because we adults are really not conditioned to respect children's boundaries very much.
I agree.
And yet,
I'm still learning a lot.
We're still learning a lot, right?
Yeah.
Right now. And yet we want them, and we need for them, particularly kids with special needs, right? We need for them to have really good boundaries. This happened this week, literally, where I was working with a nonverbal child to teach him to say no. And the parents were like, why are you teaching him to say no? Why don't you want him to do the activity that you planned for him?
Yep, I've been there. I understand.
Right, where the parents think, oh my God, this is going horribly wrong. Like, we're not getting anything done.
Yeah, because you're like, oh, and you're actually respecting it after he says no. And so, yeah, I've been in the same thing where I taught, you know, I worked on a kid to say, I don't want to. And then I was like, later on, I even had that moment. I was like, oh, I created a monster, because now it's, I don't want to. All right, we're going to do this. I don't want to. But, you know, we started to then, you can still kind of branch it out to, okay, yes, I understand you don't want to. So you're still responding to it and understand, like saying that, you know, I hear you and I understand what you're saying. So that, but maybe you can, you know, give them a 5-second or 10-second break from it and then, you know, go back. So there are ways to work through it. Right. But it's so important to respect, yes, that no, the power of protesting, and yeah.
I mean, the power of protest is huge, right? I mean, just like, I could goof out about it all day long, and clearly so could you. But it's really, really important. And those boundaries, are hugely important. How do you navigate, I'm trying to think about how I want to ask you this. How do you navigate what you think a child is going to, a prognosis with respect to a diagnosis, and then use of AugCom in that whole system? How complicated, do you know how complicated a system a child will need to use when you start? And how do you navigate that decision?
Yeah, not at all. And it's sometimes really hard to figure that out, because I really try really hard to presume competence. And even if a child, you know, is showing that, you know, that there are pretty delayed, if you look at their test scores, or if you're looking at even just, you know, their communication, whether it be in a classroom or at home, and it's showing that it's really impacted, you know, it is sometimes hard to picture them using, especially like a high-tech device that with, you know, a bunch of buttons, whether it be like 60 something buttons, but the importance is try to think about beyond. And so a lot of times there are different ways of approaching it, but a lot of times you can either still introduce a device that may have a lot of different, you know, buttons or cells, but you're only kind of showing a few at a time. And you're still giving them opportunities to babble and play around and have all of them there at times, but during those instructional times and during, you know, maybe during that speech session, you are focusing on, you know, maybe those 3 or 4 at a time to really kind of introduce them and to get them cemented before you kind of just like, hey, here are all your picture symbols all at once. So I really try to take that into account. And also, you know, there's other factors in terms of like fine motor skills and all of that too, in terms of how much, like how big the vocabulary will be. But it really can just depend on, the child's, I would say, motivation to use AAC. Sometimes, you know, I might have to really work on just that cause and effect first to really build up like understanding like, oh, okay, well, I can communicate to get this. And like, that's that cause and effect relationship, before I'm starting to work on, okay, like let's use this to answer questions for class or like in the classroom, because those are obviously very different, types of communication, and they can, I'm more of a motivated myself to communicate for some food over, answering questions in class. So I think that's also what you kind of have to think about too, is like, what is really our focus? Is it kind of be for more an academic standpoint of why we're introducing the AAC? Because I have to kind of take those different things into account depending on what role I'm serving, like in the schools versus in private practice. Although, right now everyone's at home, so it does kind of blend more now. But in the school, sometimes I have to think about, that academic purpose versus the whole picture, whole community focus. But I guess that's a long answer, but no, there's not really a set definition of like, okay, well, this kid this type of diagnosis would do well with this type of app or this type of device. It really just depends on that child. But I always try to think beyond what I should expect, because I've definitely had a situation where I've, brought in a device and I was like, okay, I think, that might be too much. So let's just start with like a field of 20 cells. And then I'm like, oh, wow, they're already beyond that. And I don't want to have to like then change their whole motor plan that they had when they were, when they made progress with the device. But so I try to think of those kind of situations and really try to think beyond what I immediately would have probably recommended at first. Yeah. So I'm still learning.
Tell me more about babbling with the device.
Mm-hmm. Yeah, it's really cool to see. A lot of times when we have a kid that might first see, a device for the first time, and they're just pushing a bunch of buttons, they're exploring it. And sometimes the parent's like, oh, they're just playing, or even a teacher sometimes like, oh, they're just playing with it. Mm-hmm. And I'm like, yeah, they are, but it's, that's part of developing language. Just like, when infants are developing language, they're babbling, they're playing around with sounds, we make mistakes when we're learning how to speak and learning, new words. And so we have to make sure we're giving that time to explore the device and see where things are. So I've, seen unfortunately situations where, especially in the schools sometimes, where, a device is taken away because like, oh, well, they're disruptive, or, oh, they're, playing around too much and they're not using it functionally. But it is functional because they're, they're learning where things are. They're hearing that sound, just like what we said before, of like hearing that, that word spoken, they're, pairing it to like, okay, well, that button makes that sound, that's that word. And a lot of times they're going to have a picture too. So they're making those connections by playing around on the device, and there are times, like I said, where we might hide vocabulary to really, focus on certain words that we're trying to teach, but it's important to have that time where everything's available to really explore. So it's a balance, but we have to make sure we give them the opportunity.
I was going to say, all of this is, particularly when we're dealing with anything that's sort of developmentally not tracking. Mm-hmm. And it's almost never across the board, but there are things that are going to be high and there are things that are going to be lower. And it's this push-pull balancing act of sort of the right combination of restriction and expansion.
Yep.
And not control. What am I trying to say? Organization.
Yeah, structure, kind of giving
structure. There you go.
Yeah.
Right. Structure and probably, as little control actually as possible. Mm-hmm. Because I always tell people, I actually can't make anybody speak.
Yeah. A lot of my kids, especially when they realize that if they feel like you are controlling and directing every part of the session, that's where you're going to get more resistance and pushback and non-compliant. So I'm trying as much as possible to help them feel like that they are, the ones driving this. So as much as possible, there are obviously some times where you have to take the lead, but I want them to be able to realize like, okay, if I push this button, if like I'm willing to get silly, do whatever, like if they're pushing up and I jump up and just start like, jumping up and down, and then they push down and they see me fall down on the floor. They're like, oh, okay, I can keep doing this. This is funny. And so so
this is why we love our jobs, right? Because we think it's hilarious too.
Yeah, exactly. Yeah, and I get steps in, I get it all. So yeah.
I can totally picture you doing that, and I would do the same thing, and everybody would be having a blast. And guess what? When we're having fun, we are learning. Oh my God. I think we're going to leave it there for now. There's so much more we could talk about. But I so appreciate you taking the time. Thank you.
Thank you. This was fun.